Healthcare is local. It's a local issue. Without knowing who your community is, without understanding what they need, what they want you to do for them, it's impossible to provide the kind of services that they will use.
Our CEO is a nurse, our Chief Operating Officer is a nurse, so we really are so patient care focused.
As a student nurse, when I worked here, I just noticed there was something different. It's like the patients mattered. It's what everything that we do is focused around the patient.
I think the difference between care and caring is just as one step. It's a very small step, but the patient can sense that when you're just providing care and when you're truly caring of the patient.
When a longtime patient brings a family picture and you realize that years have gone by, but you remember those special moments when they were born, and that makes the job really worthwhile.
We started over 50 years ago with a small community health resource called St. Paul's Hospital, and I believe it was only 18 beds. And the community got together, it was a Tri-Valley effort, to build a bigger hospital.
They came at that time, and told us that they want to build a hospital, and they were looking for pledges. And everybody, I'd say everybody pledged so much money. And then we agreed to take so much out of our check. I mean, we were poor back in them days, this is 60 years ago.
Well, the roots of our organization go back to that rural time. The community felt isolated. It was rural, it was farming, it was ranching, and the community knew it needed resources.
My eardrum was punctured by hot slag from work, and I had to go to Levine Hospital in Hayward for treatment. Back then, before Valley Memorial, we didn't have no specialists around here. All we had was general practitioners.
So there was a committee that was set up, a very special committee of community leaders who got together and said, let's go to the state and ask them to support us in building our own hospital. And that happened. And they had to do a fund drive to match the funds that the state would give them. And that's how they got the health system started. And now today, we serve over 200,000 people a year at ValleyCare Health System. And that health system is a combination of 2 major campuses, Livermore and Pleasanton, and several outreach sites.
Well, where would you go? I mean, if you didn't have it here, they'd have to haul you to Hayward. And you could die on the way, if you know what I mean.
The physicians at ValleyCare are part of the community. We're very proud of our medical staff. They continue to support the future goals of this health system. They frequently give charity care to patients. They frequently donate their time to make sure that health care is provided in the community. We couldn't ask for more. We couldn't ask for anyone to be more dedicated to a cause of healthcare than the physicians at ValleyCare Health System.
The doctors that have been here a long time we're the old guys, and we were trained in hospitals like Valley Memorial. And you know the housekeepers, you know the cooks, you know everyone in these small community hospitals. When we moved to Pleasanton, it was a bigger hospital, higher tech, more modern, but we kept that family feeling, and that's why doctors stay, because you know the first names of almost everyone you pass in the hallways.
I've stayed at ValleyCare for 28 years because it's an excellent facility to practice medicine. The quality of the medicine is fantastic here. The medical staff is a great staff to work with.
For me personally, after spending nearly a decade in a very high-profile university setting, I really wanted to be in an environment where I can be very patient-focused, spend a lot of time in the community with them, and be able to treat the patients that I live nearby and my kids go to school with.
Yeah, the culture here at ValleyCare is great. It's a great place to work. You feel like you're part of a family. And what's really wonderful here is that I get to talk to a lot of the other doctors about patient care, so I feel like it's a good place with integrated care among the different subspecialties.
I think we have a great working relationship with the entire team, starting with registration, the nursing staff, the techs, and as I said, the ancillary services, the x-ray people, the lab services. It's wonderful.
The team at ValleyCare is outstanding. They're unbelievable. Their dedication to primarily patient care and patient safety is is unparalleled. I've worked at several Bay Area hospitals, and here, above all, patient safety, patient care has been #1 all along. And it really reflects in the patient's outcomes and their perceptions of the hospital.
I believe nurses are essential to the overall complexity of healthcare. They fill a position in the mainstream of the provision of care that no one else can fill. If you came to me and you said, I have this brand new community, people are going to live here, I want you to start a health system. There are two major components you really need, a doctor and a nurse. Everything else comes in after that, but those two pillars are necessary to provide health. And nurses serve a huge role in the delivery of healthcare at all levels. It's a culture here. It's a culture of caring, and the ValleyCare nurses are the heart of this organization.
The nursing school started during the early 2000s when everyone was experiencing a nursing shortage. A lot of hospitals went to bringing nurses from other parts of the country and other parts of the world. And we truly believe that being a community-based hospital, we wanted nurses who lived and worked in our community.
What if we had our own nursing school and we had people coming through and were trained in ValleyCare's culture and then wanted to stay and became employees?
So we formed a partnership with Chabot College Nursing Program. We look for very skilled, competent nurses, while at the same time we're looking for nurses that have great empathy, great ability to advocate for their patients and their families. So we're looking for that really perfect combination of art and science. We're about to graduate our 7th class next week, and the majority of those nurses remain at ValleyCare.
Our nurses excel in all levels, the certifications, the degrees, the excellence in what they provide. We have an international nursing team that goes out internationally and builds clinics in underserved countries.
When the Soviet Union collapsed, they took all the equipment. So here are highly trained people and no equipment. We've been able to come in and put in intensive care units and pediatric emergency rooms, and they're just absolutely thrilled. Well, you don't read about that stuff in the newspaper, but that's happening all over the place. USAID and American International Health Alliance, whom we'd worked with in Russia, came to us and said, you know, would you be willing to do another project similar to the one that you did in Russia, only now in Azerbaijan?
One of the most difficult stories for us was when Dr. Mike Ranahan, one of our retired obstetricians, and I walked into a maternity hospital in Azerbaijan. It felt like we were probably going into about the 1940s.
We wanted to know what it was that we could do to help. And so we worked out a plan, and it was a 3-year plan. We brought people over here. We took medical professionals over there. We still communicate with some of those same people, and it proved to be very, very successful.
Having babies is a real important part of the growth of a community, the healthiness of a community. And I have a real passion and commitment about the kind of services that our babies and our children get. And one of the things that I've been made aware of by my community is that when their children are ill, they don't want to leave the community. So we have tried through a university affiliation with UCSF to bring specialists and resources here to ValleyCare.
The team we work with at ValleyCare is made up of local physicians, pediatricians, anesthesiologists, and then we partner with UCSF for our neonatology and our perinatology. So the team is made up of ValleyCare-based physicians as well as university-based physicians.
UCSF provides a lot of support, ancillary support, and also professional development support for the physician staff here. It provides that ongoing education for us, but it also translates to excellent care for the patients here. Ultimately, we're dealing with people, and while sometimes the small children that we're dealing with don't understand what's going on, parents have a very have a very stressful situation to deal with.
Our babies came 5.5 weeks early, so it was a little bit unexpected. And we went to the emergency room because we weren't really sure what was happening, but we were quickly informed that what was happening was I was giving birth 5.5 weeks early. Now, what does that mean? I had no idea, but I had a C-section, and pretty much when I woke up, the babies were in the NICU. Over the next 24 hours, I was recovering from my surgery, and they were pretty much fighting for their lives while my husband was in there with them.
Cameron was having a little trouble breathing, and I could see her chest she was fighting to breathe, and I was very nervous. The nurse didn't seem nervous. She seemed very calm and like this just happens all the time. I got a little worried when she said, you know, call Henry on her phone. To me, that meant you're calling in help.
The father, I think, was, you know, as might be expected, very anxious and didn't know what to expect. And I think I just wanted to let him know that we were going to be able to help.
I just sat back and watched this guy work his magic and watched him literally save my little girl's life. It was one of the most incredible things I've ever experienced in my life. And just watching this guy work was absolutely amazing. I owe my daughter's life to this guy. I could never thank him enough.
It doesn't matter where you live or who you are or what health insurance you have. At some time, almost everyone in this community uses our emergency services. Our emergency services are so important to us that we have refined our response to taking care of heart attack patients so that we have national recognition for that performance. We've been featured in U.S. News and World Report as one of the best cardiac hospitals. We also were the recipient of a special study done by Yale University that studied high-performing medical centers in the treatment of heart attack patients. They wanted to know how could a suburban community hospital exceed national standards when some of the largest academic medical centers in the country could not perform that well.
So 53 days ago, I had a heart attack while I was at the gym. There just happened to be an off-duty paramedic that was getting a drink of water right next to the machine I was on. It took Roy 4 minutes and 23 seconds of steady compressions to my chest to get me breathing again. And within 15 minutes, the paramedics, the ambulance arrived. They had to put the defibrillator and do that again in the ambulance on the way to ValleyCare Hospital in Pleasanton.
So within the past year, ValleyCare, in conjunction with the County Emergency Medical Services, has initiated a program whereby paramedics that are responding to a patient with chest pain are able to transmit an EKG directly to the hospital over a wireless system. And this has allowed us to be able to make a diagnosis of an acute heart attack in a much more timely fashion, so that even before the patient arrives at the hospital, the emergency department is able to activate the cardiac response team, and it allows us to provide very timely care in a situation where time really is a very meaningful part of treatment.
I think ValleyCare exceeds the national benchmark of 90 minutes due to the fact that we do have a capability of receiving the EKG from the paramedics in the field, and then we have such a cohesive and well-working team here at ValleyCare with the cath lab and all the ER team.
Dr. Zucker and the ValleyCare cardiac team did a great job with the procedure that I went through to get the stent put into my heart.
It's actually not surgery. It's really a catheter-based procedure that's done essentially in a sophisticated X-ray room. The patients are sedated to a moderate degree. Some patients fall off to sleep and basically snooze through the whole thing. Other patients are more awake and alert and are actually asking questions and are talkative throughout the procedure.
You could see that my lower left artery, the blood was only flowing about halfway down and it was stopping. Within 15 minutes, I heard Dr. Zucker say, "There it is," and then they placed a stent into the blocked artery, and I'm watching all of this, and then you can see the blood just flowing through the artery the way it should be.
Cardiac rehab is a program that's been around for quite a number of years. And actually, just recently, there's been literature that supports the idea that having patients go through a monitored exercise program after a major cardiovascular event, in fact, prolongs the life of those patients.
I feel fantastic. Working with the nutritionists at ValleyCare, I've able to lose 33 pounds, and I feel a lot better. More importantly, I've learned a lesson about nutrition and being heart healthy. I would personally like to thank ValleyCare for giving me my life back.
Oh my goodness, I think ValleyCare has brought me a whole new life. That's probably the best way I can think of describing it. I came in here kind of a sad person who had all kinds of health conditions that were really raging out of control, and I knew I needed to do something pretty serious to lose weight.
Before surgery, when I met Gail, she had struggled with her weight for years. She had major complications of her weight and was really feeling like, her health was failing. And she was in a situation where she really had to do something to intervene. Otherwise, she was going to have a shortened lifespan.
I couldn't walk from my car to my office without stopping halfway and sitting down and catching my breath and making my heart, stop pounding so much, and was starting to look at scooters, thinking, you know what, this is crazy. I can't do anything anymore.
I think there's a lot of misunderstanding about the disease, morbid obesity, and that's what we are treating with weight loss surgery. These patients have a serious medical condition. This is not a cosmetic treatment or procedure. They're facing serious health consequences. And they're not able to lose this much weight, not because of a lack of willpower or effort, it's because they really have a disease process.
I was really at a moment of almost desperation. What do I do to get my life back? And coming here, I did. I've lost 254 pounds now, and since I started this journey off a couple of years ago. And I can do anything I want to do now, I feel like. It's really great.
When I see someone by 6 months and they don't have diabetes anymore and they're off all their blood pressure medicines and they're, active every day or taking up a new sport or a new hobby because they feel so much better about themselves, it's tremendously rewarding.
So one of the reasons why I chose ValleyCare as the program for me was because of the education and the support for all of the patients in the program. We went through a battery of medical tests, of course, but also had a psychological examination to make sure you were mentally prepared for the life changes that would happen as a result of the procedure. Amazing nutritional counseling really emphasized the importance of everything that you'll have to really take on as a commitment for life after having the procedure. There are no words, right, to give to all the people who have helped so much. Just say thank you. Truly, at the end of the day, thanks for the encouragement. Thanks for, I told you I was going to do that. Just thank you.
Several years ago, I had a community member approach me and talk to me about his experience with cancer. His wife had cancer, and she was being treated at one of the university hospitals in the Bay Area. And the last trip that they tried to make over the Bay Bridge didn't turn out well. She got very ill in the car, and he had to turn around and bring her back home. And he was very unhappy, and he said, Marcy, you talk about being committed to this community. You have to change this. You have to bring the care here. We can't make those trips anymore.
Things are different now. We have a comprehensive cancer center here right in Pleasanton at ValleyCare, and we have university-level expertise. We have state-of-the-art treatments available. We have access to clinical trials. We have many of our physicians have come right out of academic medicine and have planted here to build a strong program, and we're very proud of that.
I have the pleasure of working with a lot of other great doctors, and we're also in constant contact with surrounding academic institutions. So we keep in touch with what's the latest and greatest in patient care, in diagnostics, in tests or procedures that are available. And I think we have a really great community presence, which is very important because these are the people that we want to take care of in our own community.
One of the things that we have done here at ValleyCare that's very different, I believe, for a community hospital is we have established a university affiliation with UC Davis, which has a world-renowned cancer treatment center.
So we wanted to be part of that. We wanted our patients to be part of that. We wanted our patients to be at the, at sort of the crest of the wave, at the cutting edge of cancer delivery. So that's where the UC Davis affiliation helped, because we were able to open multiple clinical trials here that our patients can access without having to travel outside the community. The second aspect of that affiliation is the professional dialogue through the virtual tumor board. Now, these tumor boards are actually very unique to cancer medicine. There is no other subspecialty out there where physicians bring their patient cases to a roundtable conference where other physicians also sit and hear about the case and participate. And at the end of it, there's a consensus opinion on what should be done next.
We've invested in technology, the latest in radiation therapy, the latest in chemotherapy. And so for me, I was sorry that we waited so long to make that commitment, that it took a community member to come and say to me, you need to do something about this.
So many times I think it's overwhelming for patients when they're diagnosed with something that even possibly could be cancer. So most of my job is just to help them feel empowered about what they can do.
I was first introduced to her when I was going through chemo at the ValleyCare Cancer Center. Like I told Mary, I says, I've never cried before. When I got it diagnosed, never cried. But now I feel like crying. I didn't feel like I was so lost anymore.
Where I find navigation has made the biggest difference for our patients is they have a real person to talk to along the way, and someone that can answer questions for them, offer support, educate them on how to prepare for each test, when the test results are going to be in, and what they need to do about it.
She had all these various programs going on, and she definitely led me to the support group. I was hesitant at first because I just didn't want sad people being around, because this was a bad time and I didn't want to be around sad situations all the time. So I told her, well, it's not for me just yet. But she kept giving me some of these brochures and kept me informed on things. Finally, I went to the support group. Best move I ever made.
I sit among giants when I sit in the cancer support group, to hear them laugh and what they've had to go through and how they find humor and encouragement for each other. I'm humbled every time I'm there. It just makes me feel like I can't give enough back for what they've given me.
I'm doing great. I have good outlook on things. Something I've learned too is find anything that makes you laugh. That helps. And just enjoy life.
One of the centers of excellence for ValleyCare is our orthopedic care, and recently we have been able to recruit some of the top orthopedic specialists in the country. Between our spine program and our general orthopedics program, we have here available to our community the best specialists to provide joint care in the future.
Here at ValleyCare, we've had a chance to put together a full multidisciplinary team, including physical therapists, pharmacists who manage your medication, nutritionists who will help with your dietary needs during your stay, all the way through preoperative education before your surgery, and then postoperatively assisting you back to home. The administration here was very forward-thinking in trying to adopt new technologies, new protocols that would help grow a program that would be ready for the future of orthopedics.
Before my hip replacement surgery, I was in a great deal of pain. I was taking anti-inflammatories and painkillers on a daily basis. Just before my surgery, I was almost unable to walk.
Once we had a good diagnosis on her and realized that her hip was severely arthritic, we did use the anterior approach for her. And last time I saw her, she actually mentioned that she completely has forgotten that she's even had surgery.
My walker went away after the first week. My cane went away after the second week. I took very few painkillers immediately after my surgery. I'm thankful to ValleyCare for giving me the opportunity to start my life over again.
I went to Europe and before I had the surgery. The sights were great, but I was miserable because of walking. When I got back, I had the surgery. I wished I would have had the surgery before I went to Italy.
Tom Miller, great guy. He had a very debilitating disease in his knee, severe degeneration, and he was walking around like he was 100 years old. We were able to use the custom knee technology to provide him with a perfectly sized and, in my opinion, perfectly oriented knee replacement so that he could get back to what he wanted to do.
My wife and I walk every day, and I do yard work. I love doing yard work. Having my knee done, I can enjoy myself.
The absolute most rewarding part of this job is having patients come back in, they see me and they give me a giant hug. They're finally doing what they want to do. Their pain is gone, and to me that makes every day worth it.
We have a portion of our community that really comes here and supports this organization. It's our auxiliary, our volunteers. They have donated over the life of this organization millions of dollars.
Well, of course, the medical procedures have changed enormously, just enormously. Even I remember giving a tour of the new hospital in 1991 when laparoscopy was just coming in. Medical equipment has to move along with the times, and of course that's where the auxiliary has helped. We've given over $5 million for equipment for the hospital.
But what they've really given is of themselves. They come here and they've donated thousands and thousands of personal hours to the support of this organization, from running errands to supporting patients to transporting patients to running gift shops, thrift shops, but any way and fashion that they can help us, they're there for us every day.
The auxiliary has donated over 1.5 million hours to ValleyCare, and we're very proud of that. It's been a wonderful time. I've met wonderful people, and I certainly want to congratulate them on their 50 years of service to the community. They're very supportive of the volunteers. We love working for them and for the hospital, and it's just a very rewarding experience.
Our auxiliary provide us with the greatest amount of love and outreach from this community, and we're so proud to have each and every one of them a part of our organization.
I think the foundation of good health care exists in our community, and it's founded in a strong relationship between the patient and the physicians. And we also currently, for years, have been practicing excellent patient-centered preventative medicine. And much of the changes that are occurring in healthcare are rooted in that, and I think we're well prepared to proceed to continue to provide good care on that level.
We're very proud to have our relationship, our partnership with these doctors. We look forward in the future as changes come about with healthcare reform, with continuing to build a partnership with them.
I think ValleyCare has the right value system to move into the new directions healthcare is going. I personally believe that we're going to see more and more emphasis on preventative medicine. We're going to see more and more emphasis on how do you keep people well for as long as you possibly can.
Our commitment to wellness is evident in Lifestyle RX. That facility was built specifically to maintain the health of our community, and I think it's been widely accepted by many people in the community as a place to go to maintain their health. To have a health system or not have a health system is at the crux of the future of healthcare, even in this state. Several hospitals have closed over the last 10 years in the state of California, and there are communities who don't have hospitals now as a result of the lack of support for their hospital. We will commit ourselves and dedicate ourselves to the Tri-Valley, the community we serve, but we need the Tri-Valley, this community, to support us and dedicate their commitment to us.